Aerobic interval training. Disclaimer: the information contained here should not be a substitute for the advice of a qualified licensed physician or other health providers. The information provided is for informational purposes only. Please check with your physician or healthcare provider with any questions or concerns. Aerobic interval training is alternating periods of intense effort during exercise with periods of moderate to low effort. You work at a rate of perceived exertion greater than 13 or 14 or somewhat hard for a short period of time, followed by a recovery at a rate of perceived exertion of 11 or fairly light. This allows breathing to recover, but it does not allow your heart rate to completely recover back to rest. The active recovery phase is important for safety. Steady-state exercise training involves exercising at a moderate intensity for a specific amount of time during your exercise session. The recommendation is 20 to 60 minutes per session. You are trying to work at a rating of perceived exertion of 11, fairly light, to 14, somewhat hard. You should be able to talk to others without gasping for air. Speaking will take a little more effort than usual, but you should be able to carry on a conversation. You often maintain the same resistance level or the same pace during the session. A few benefits of exercise training is that it improves the body's ability to do daily activities, it improves good cholesterol and lowers bad cholesterol. Exercise training also lowers body fat, can help control blood pressure, and decreases stress. Aerobic interval training versus steady-state exercise. Aerobic interval training builds lean muscle mass faster, boosts metabolism longer, and burns more calories compared to steady-state exercise. If you have heart disease or a clinical diagnosis, check with your physician or health provider before starting aerobic interval training. Safety concerns. Make sure you exercise below the level of pain or discomfort. If you have heart disease, exercise below the level of angina symptoms. Please see the video on angina for more details. If you experience angina or any discomfort while doing aerobic interval training, stop the activity. A stress test, if available, can help ensure that your heart is ready and able to do a higher level of work. Stress tests measure the body's ability to use oxygen and assess your heart's ability to deliver the oxygen to working muscles. They can help determine safe workloads and a safe heart rate range. How do you make the intervals higher intensity? You can increase your speed by increasing your pace or your movement. If you have joint pain, consider doing higher speed without impact or carrying your weight. You can add incline, which can challenge your muscles when speed increases are not an option. Another option is resistance. Try adding resistance without slowing your pace. Also consider making bigger movements, which require more muscle fibers to work. Another way to increase intensity is alternating lower with upper body. Try to work your arms at the same pace as your legs. You can power the movement with your arms, allowing your legs to recover, then switch to powering the movement with your legs, allowing your arms to recover. Lastly, consider impact and gravity. Consider exercises that work against gravity like squatting, push-ups, or chair dips. You can also consider high-impact activities like jogging or running. These are not recommended for those who have joint injuries or are just starting intervals.